Dr. Lavan. So I'm with Tim again from Surrey Physio, who's kindly here with us today to discuss various problems with the musculoskeletal area. But one question I've always been quite keen to understand is ultrasound. So ultrasound, as doctors, we typically use to diagnose, to looking areas for tears or inflammation and finding out how we can help. But actually there is a place for ultrasound in treatment for these patients, and Tim hopefully will be able to explain it firstly for us and hopefully possibly demonstrate, which would be great. So Tim, what is ultrasound and how is it used with you guys?
Ultrasound is a high frequency sound wave that goes into the tissues, which can help stimulate blood flow to the tissues. Okay, now there is there's different varying levels of research on the benefits of ultrasound.
Okay.
Now there's some evidence that suggests that it can be useful, and there's some evidence that suggests that it does absolutely nothing at all.
Okay.
And you do tend to find that with certain modalities and certain medical instruments, if you like. And now, what's my personal experience of ultrasound? I have to say I do find it quite useful. I originally was taught ultrasound by my predecessor, who was taught ultrasound by his father, who was a physiotherapist back in the 60s. And he taught his son, who was long retired now, and then he taught myself, and he used it very successfully, and he showed me how to use it very successfully. I think the nice thing about ultrasound is it's extremely gentle, it's very comfortable, it feels very relaxing, it's a nice thing to use at the end of the treatment. My personal belief is it does tend to work. It doesn't work on everybody, but the thing is ultrasound is like anything with a treatment program. Let's say that you come and see me with carpal tunnel syndrome or shoulder pain, and I say, well, let's try some ultrasound. We don't just use ultrasound. We might use ultrasound, so we'll typically use it for 5 minutes on the area to help reduce pain and encourage blood flow. But we don't just use ultrasound. We might do exercises. We might do some manual therapy, we might do some strengthening rehabilitation, we might give you advice, we might talk about your posture, we might talk about your ergonomic and workstation setup. So, we treat patients holistically.
Yeah.
Ultrasound is one part of a possible treatment, and it's a useful part, but there's other parts, the exercises, the guidance. So ultrasound is very, very good. I like it, I think it does work on a lot of people. And I'm really happy to show you if you'd like to see.
Lovely, let's have a go.
We tend to use ultrasound gel to help the sound waves go into the tissue. And this is my ultrasound machine. Now what I'll do is I'll set the ultrasound machine up to provide the required dosage and frequency of sound wave. We're going to set the time, we're going to set the strength, and we're going to set the wave and the frequency of sound wave. Different frequencies have different effects, some go deeper, some go more shallow. I'm going to press my start button and we'll simply hold the ultrasound machine over the area of pain, like so. This will typically last about 5 minutes. The patient won't feel any pain, but they may feel a little bit of warmth. At the end of the treatment it will bleep and the treatment will be finished. And our patient is good to now start some exercises on that.
Thank you, Tim.
Okay.